CJE9 sexual assault investigation at Lyceum of the Philippines, Batangas. July to November 2026. Facilitator is Noel Minay, MD, FPSP, certifications in anatomic and forensic pathology, sexual assault investigation, as framed within Philippine CHED or Commission on Higher Education, recognized forensic science programs in the Philippines, refers to the systematic, trauma-informed, and addition by the present facilitator, medico-legal and investigative process used to document, analyze, and interpret allegations of sexual harm. It integrates clinical assessment, forensic evidence recovery, legal requirements under Philippine law, and interdisciplinary coordination with justice and protection agencies. The goal is to produce objective, neutral, scientifically defensible findings that support both victim safety and judicial due process. 1. Conceptual foundation. Sexual assault is defined in Philippine jurisprudence, RPC, RA 8353, RA 7610, RA 9775, as non-consensual sexual contact or exploitation, including acts committed through force, intimidation, coercion, deception, abuse of authority, or when the victim is incapable of valid consent, for example, intoxication, minority, mental incapacity. Our teaching emphasizes that consent is a legal construct and that medical findings alone cannot prove or disprove rape. 2. Trauma-informed, victim-centered approach prioritize, immediate safety and medical stabilization, respectful non-leading communication, informed consent for every step of the process, minimization of re-traumatization, autonomy in reporting decisions, except where mandatory reporting applies, for example, minors under RA 7610. This approach ensures that forensic procedures do not compromise the patient's psychological well-being. 3. Medico-legal history. Taking the investigative history is focused, time-anchored, and non-suggestive, covering timing of the incident, type of contact, oral, anal, vaginal, digital object, condom use, ejaculation or contraception, post-assault activities, washing, urination, clothing changes, menstrual status and prior consensual intercourse, symptoms, pain, bleeding, psychological distress. This emphasizes that the history is the patient's narrative, not a medical conclusion. 4. Forensic examination. The physical examination follows a head-to-toe and a no-genital protocol using neutral descriptive terminology, diagrams and photography with consent, documentation of injuries, normal variants and absence of findings, avoidance of interpretive or legal language. This guidance stresses that normal findings do not exclude sexual assault, especially in children. 5. Evidence collection and chain of custody. Evidence collection is time-sensitive and may include swabs, oral, genital, anal, skin, fingernail scrapings, clothing and foreign materials, blood and urine for toxicology, pregnancy and ST, eye testing, strict chain of custody, labeling, sealing, signatures, timestamps, and transfer documentation is essential for court admissibility under Philippine medico-legal practice. 6. Laboratory and clinical management. The investigation includes baseline STI testing, emergency contraception, HIV post-exposure prophylaxis when indicated, hepatitis B immunization, follow-up medical and psychosocial care. This emphasizes integration of therapeutic and evidentiary aims within one encounter with clear role boundaries. 7. Legal and jurisprudential context. Students must understand elements of rape and sexual offenses under RPC and RA 8353, child-specific protections under RA 7610 and RA 9775. Jurisprudential themes. Physical injury is not required for conviction. Delay in reporting is common and legally recognized. Credibility of testimony is often central. Virginity has no medico-legal value. Investigators and medico-legal officers must avoid legal conclusions, focusing instead on objective findings. 8. interdisciplinary coordination with police and forensic laboratories, social workers and child protection units, psychologists and crisis centers, prosecutors and courts. This ensures holistic safeguarding, especially for minors and vulnerable adults. 9. Reporting and courtroom responsibilities. The medico-legal report must separate history, findings, and opinion, use clear, neutral, defensible language, avoid statements such as rape occurred, prepare the examiner for cross-examination, focusing on scientific accuracy and professional neutrality. 10. Educational purpose, CHED forensic science. Within CHED recognized forensic science curricula, sexual assault investigation is taught to build competence in scientific documentation, develop ethical and trauma-informed practice, strengthen understanding of Philippine legal frameworks, train students to produce objective, defensible medico-legal outputs, prepare graduates for roles in law enforcement, medico-legal services, forensic laboratories, and child protection systems. Application practice of sexual assault investigation in the Philippines carries not only scientific and legal obligations, but also an ethical necessity, a duty to ensure that medico-legal services remain accessible, humane, and protective of the most vulnerable Filipinos, especially those who are financially disadvantaged or mentally deficient. This ethical dimension flows directly from the CHED-aligned foundations in your course document, which emphasize trauma-informed care, neutrality, and safeguarding. 1. Ethical necessity in community service. In real-world practice, sexual assault investigation becomes an ethical obligation because poor and marginalized Filipinos often have limited access to medico-legal services, making forensic practitioners one of the few gateways to justice. Persons with mental deficiency or neurodevelopmental conditions are disproportionately targeted and require heightened protection, clearer communication, and non-coercive procedures. Trauma-informed, respectful handling is essential to prevent further harm, especially when victims already face social stigma, poverty, or cognitive vulnerability. Neutral, defensible documentation protects victims from systemic injustice, ensuring that their cases are not dismissed due to lack of resources or misunderstanding of their condition. 2. Operationalizing ethical necessity in practice. A CHED-aligned, community-oriented practitioner integrates ethics into daily work by providing clear, simple, non-leading explanations for every step of the examination adapted to the patient's cognitive level, ensuring informed consent using supported decision-making for mentally deficient individuals and involving legally authorized representatives when required, advocating for free or subsidized medico-legal access, especially in rural or resource-poor settings, documenting objectively and neutrally, protecting victims from misinterpretation or bias, coordinating with social workers, barangay officials, and child/women protection units, ensuring that vulnerable victims are not left alone in navigating the justice system, recognizing that normal findings do not negate sexual assault, preventing wrongful dismissal of cases involving children or cognitively impaired adults. 3. Ethical necessity as a professional identity. For Filipino forensic practitioners, especially those trained under CHED-aligned programs, learn ethical service is not optional, it is a core professional identity. The role extends beyond evidence collection to protecting dignity, autonomy, and safety. Practitioners become bridges between marginalized communities and the justice system, ensuring that poverty or mental deficiency never becomes a barrier to truth-seeking. In serving the Filipino community, especially the financially poor and mentally deficient, sexual assault investigation is not only a scientific and legal function but an ethical necessity, a commitment to ensure that every victim receives trauma-informed, accessible, and defensible medico-legal care regardless of socioeconomic or cognitive status. Ang aming sigaw, your conscience is your guide. 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 You can become a forensic scientist by taking a 3-year bachelor's degree in forensic science at the Lyceum of the Philippines, Batangas, or a 4-year fast-track double degree criminology and forensic science, and progress to masteral and doctorate degrees as well. Faculty members handling these courses are industry experienced and have advanced related degrees, plus a state-of-the-art forensics training equipment. Padayon.